Hi, my name is Nancy, and this is my YouTube channel on CRPS, also known as Complex Regional Pain Syndrome, RSD, and Reflex Sympathetic Dystrophy. In this channel, we will take a deep dive into CRPS, talking about what it is, how it's treated, and associated illnesses. So stay tuned for more. As I said in the first part, I would talk a little bit about IV access. There are two most common types of IV access used for ketamine infusion. The first is the traditional peripheral IV. An intravenous line is a soft, flexible tube that is placed inside the vein, usually in the hand or the arm. The healthcare provider uses the IV line to give the person medication and fluids. Peripheral IV are usually left in for a few days since most of us with CRPS are hard sticks. The disadvantage is IV sticks can cause CRPS and cause the spread of CRPS. There's the possibility of phlebitis, which is inflammation of the vein, and the risk of infection. A port is a surgically implanted IV line. The advantage is that once it's accessed, it can be accessed for a week. It does not have the risk of spread like a peripheral IV because the needle's only going through the skin. If you get ketamine with your anesthesia, then you will not have the risk of the peripheral IV or the surgery if you have a port. It needs to be flushed once a month, and there is risk of infection. I've had a port since 1999, not the same one, and I have never had a port infection. As a nurse, I know sterile technique and I access my own port. So getting a port, a small incision is made on the upper chest. The device is implanted and sutured in place. The catheter is then put in a large vein close to the heart. This is what the device looks like before it's inserted. These are going to be photos of me flushing my own port. I first got a port back in 1999. I was admitted for lidocaine infusions, and as I said, no one could get a peripheral IV in me in the hospital. They put in a femoral line, which is in the groin, and took me to the operating room to get the port.